Our talk today is by Mike Malek. Mike Malek is currently working with Medtronic. He's going to be talking, as I say, on how we take data, technology, and improve outcomes and improve care processes.
So I need to get the legalities out of the way first. I am actually currently employed by Medtronic, but this talk does not represent the views or the opinions of my current company or any previous employer. I have to do that, being part of a multinational, but, I'm going to be talking about healthcare solutions. I'm going to be talking about innovation, and I'm going to be talking about how do we integrate patient pathways into that, and why is it really important. 1 year ago, exactly on January 16, 2017, I posted an article that I had written on disruption and predicting disruption in the healthcare sector. And the idea behind it is we could see a lot of disruption happening around us. It started, I would say, maybe 5 years ago. A lot of it was driven, I would say, with digital solutions and the fact that consumers and users needed to be more and more empowered. And I was trying to predict where would be the next disruption coming from. Actually, in that article, there were two ideas. One, which was insurance could be the next big thing, or healthcare could be the next big thing. I actually think today we're seeing both moving relatively at equal speeds, and we'll talk a bit more around that. But what was interesting in that talk, and why am I referring to that talk? I got one of the two very interesting comments that I got and got me thinking, really, was one from Christian Neckerman, who's a management consultant. I mean, you can see his very high-level credentials. But one of the things he told me was, I believe the timing will be right when 2 to 3 major breakthroughs come together and when new business models emerge. So he's saying, Michael, yeah, I kind of agree that there will be a disruption in healthcare, but how can we time it and how can we know when it's really happening? I tend to believe that this is actually happening today, and let me tell you why. For me, if he's talking about 2 or 3 breakthroughs, well, in this year so far, what we can see is definitely there's a value-based healthcare discussion globally happening around the world. Maybe perhaps it's a bit more driven in Europe than in the rest of the world, but it's still going. And I think it's worth digging a bit deeper into value-based healthcare and what does it really mean. And you'll see that in my next slide. Again, this whole recent discussion on blockchain, big data, and this technology, how can we apply it in healthcare? How can we apply it on things like patient confidentiality and then allowing this big transfer of data like Tracy was talking before? And the third one is insurance. And I'm saying insurance maybe as a specific sector, but in general, payers are evolving. And payers are becoming more and more complex. And they are putting a lot of pressures on big pharma, on big technology companies like us to try and figure out and improve our business models. These two last topics are really huge, so I will leave them for any questions that you might have later, and they deserve separate discussions. Value-based healthcare is a bit more easy, I would say, to summarize, so I will talk a bit about value-based healthcare. So this model of value-based healthcare has been developed by Dr. Michael Porter. You know the 5 forces of Porter, so he was actually thinking of how can he define value-based healthcare. And he said the following. He said, if you have an integrated practice unit, does it have a laser? Yeah, it's fine. You have an integrated practice unit, excuse me, there's a typo, into integrated practice units. What is that? Basically, if you put one unit which has all the services that any therapeutical area needs in one place, and you put it in one location with people who are just dedicated for this one little thing, let's say type 1 diabetes patients. If you have one integrated practice unit just focusing on these patients, then you have an integrated practice unit. Then you have to measure outcomes, but not only outcomes, and I mean, it was interesting walking around, a lot of people were claiming outcomes, but I think it's very interesting to see that you can measure outcomes and you can measure cost. And it's not only on a global basis, it's a per patient basis. That, I think, is another level. And as we dig deeper in integrated health solutions, the team I'm part of, we realize that there is a big gap today in the market in terms of really understanding costs and outcomes per patient. Now, you have to move into a bundled payment for care cycle. What does that mean? That means, you can't have a model where you're paying for each service. If I visit the doctor, I pay. If I buy my medication, I have to pay. If I visit a dietitian, I have to pay. If I visit a physiotherapist, I have to pay. Maybe all of these are related to my current illness. So anything that is related to my current illness should be bundled in one payment. And me, as a care provider, I am obliged to care for you for this one, let's say, bundled fee for the whole year. Think of it as a subscription in a gym, for example. Then you have to integrate that care delivery between separate facilities. What does that mean? That means wherever I go as a patient, I should be able to get the same level of care and the same expectations I had from the original place where I subscribed. And my files should be there, my data should be there, my history should be there, information should be available. And then you expand that service globally, which means you go beyond this current geography that you're in. So if you combine all of these, it becomes obvious that the underlying factor that will allow all this interaction is a very strong information system, which is a nice transition to what I wanted to say later on the IT innovation and how it should be mapping with patient pathways. So technology is at the heart of all this, and honestly, it is the thing that allows all this to happen. The second interesting comment I got was from Matthias, and Matthias said, well, I feel like we in the healthcare industry, it's like a frog in the heating pot, which does not realize that water is constantly getting warmer and warmer until he dies. So what could incumbents in healthcare do? There's only one way to survive, according to Matthias, is try to understand the customer needs and the pain points in the customer journey, and therefore adapt our models to that. So and try to solve the pain points better than your competition or in the industry. So that got me really thinking. And if we want to look at what IT should be allowing us to do, really, it's like, the tower, at the airports trying to manage all these planes flying together. If you think about it, the plane spends most of its time in the air. And the only point of contact is that tower. So you don't really know what's happening, in that plane most of its lifetime. And so we, as healthcare providers, should be able to monitor our patients while they're traveling, or while they're actually away from our hospital or clinic or wherever it is that we're supplying our service. So these two can only happen if you understand the patient pathway and the patient journey, and then you design your IT solution to map to that care pathway. So let's take type 1 diabetes, for example. I take it because actually this is currently our focus. Today I'm focusing on that as a team, trying to figure out the best solution for that. It's a very difficult disease because it hits children. It's at a very early stage. Parents are really overwhelmed with what can they do to manage that disease. The children don't necessarily understand how they need to adapt to it, and very easily, it becomes a very difficult circle to be in. Now, we spend around 8,760 hours per year, and we only see our doctor, let's say for type 1 diabetic, when they visit the doctor, maybe what, for 2 hours per year, something like that. So most of the time, the patient is away. They're living their life. They're at school. They're at home. They're playing. And we as care providers are not able really to monitor what's happening. So our technology should really allow us to do that. Today, we should be able to be at the home with the patient, with the type 1 child. We should be able to adapt to their lifestyle. We should have our care next to them available 24/7. And all of that is only possible if we understand at each point in time where this patient is going to be, what kind of needs do they have, and therefore how can I cater to them remotely from where I am. So if I want to conclude, I would say users and their empowerment are the so far ultimate drivers for what we've seen in terms of disruptions and innovations. And I think healthcare is no exception to that. We need to know where our patients are most suffering. How do they go through their patient journey from point A to point Z actually. And therefore we design our solutions to empower those patients to take control of their lives, and therefore basically get better outcomes and better quality of life. Otherwise, I think, maybe it's not today, maybe it's not tomorrow, maybe it's 2 years, 3 years, but I guarantee you, if we don't look at that, we will be like the frog in the heating pot, and before we notice, it will be too late. So I just wanted to have this talk as a thought-provoking talk, and I'm open for questions. Thank you.
Michael, thank you very much for that. Definitely thought-provoking. There's no doubt about that. Before I open up, I'm a little bit selfish right now because I want to understand one thing, which is you mentioned 2 hours for diabetes type 1 patient that actually he spends or she spends with a doctor. Mm-hmm. You also talked about we have to empower the patients more to take an active role in their health journey.
Correct.
How do you think we can, on the one side, bridge this gap of just having this point of 2 hours for an entire year to have a holistic viewpoint of what is happening with that patient, and in addition to that, then also empowering the patient to actively participate in the health journey?
Yeah, exactly. So I didn't want to go too much into detail because this is a bit part of what we do today, but there are technologies available that would allow you basically to monitor your patient from a distance. So what you do today with technology, let's say if you're talking about type 1 or type 2, you have your devices that are constantly monitoring the patient's insulin, and they automatically upload data. And that data is captured by systems that you have at a central location or at an integrated practice unit, like we were saying before. And that data is collected and then observed and monitored. And there are a few things that happen. Either a system will detect an anomaly, and then it will send an automatic email by itself based on a certain algorithm already pre-programmed to tell the patient adjust this or that, change your insulin level. Or it will raise a concern to a nurse, and if a nurse cannot deal with it, it will raise a concern to a doctor, and therefore that doctor will contact the patient to adjust, or if it needs to dispatch an ambulance, it will dispatch an ambulance. And therefore, you are no longer just relying on that interaction with the patient for the 2 hours that you're spending with them, but you're actually monitoring them across. And what is more interesting, as you collect more and more data, and as you observe through all the patients that are feeding this information to you, you start developing predictive capabilities and being able to even preempt the incidents from happening, or prevent them from happening before they actually take place. So technology, like I was saying, is obviously at the base of all this, but I have to insist, it doesn't mean that you just get me a system and my problem is resolved. You have to understand that patient pathway. If it's diabetes, it's diabetes. If it's cardiac, it's whatever it is. You have to understand where this patient is and where are their pain points, and then design your systems to target those.
Sounds perfect. Which questions do we have from the audience?
No questions.
No question. That means it was completely clear. Oh, one over there. Perfect.
Hi.
Hi.
Great talk, thank you. You mentioned big data and blockchain.
Yeah.
Any interesting developments going on, or any products in that arena currently, or research, or anything like that?
No, to be honest, I don't know a lot of details on what's happening on the healthcare sector in that. I know that there are a lot of interest, and I know there's Google working a lot on that, but I don't have any, I would say, concrete examples I can give you of what they're doing today. But I can tell you where they're going. The direction they're going towards is try to see how can we capture patient data without having to go through all the regulatory requirements of privacy. or actually covering all the regulatory requirements of privacy, while being able to interact with the patient directly and not have to, accumulate data in a database and then analyze it based on a full population. You can actually start analyzing data from that particular patient, and that's where they're trying to use that technology.
Any further questions? Well, Michael, thank you very much for that. Really appreciate that.